Heart 1 is in the center of the axilla. You need to locate this point by abducting the arm. This brings the pectoralis major muscle into relief. The point in the center of the axilla is posterior to this pectoralis major muscle, but not on the torso. It's where the arm and the body join. Heart 2 is threesome proximal to heart 3, in the groove medial to biceps brachii. Heart 3 is at the medial aspect of the elbow, midway between the medial epicondyle of the humerus and pericardium 3. So coming midway between those 2 points and the medial aspect of the transvercubital crease. Heart 4 is on the flexor aspect of the forearm. It's 1.5 cm proximal to heart 7, radial to this flexor carpal ulnaris. Heart 5 is on the flexor aspect of the forearm. It's 1 cm proximal to heart 7, on the radial side of this flexor carpal ulnaris. Heart 6 is on the flexor aspect of the forearm. It's 0.5 cm proximal to heart 7, on the radial side of this flexor carpal ulnaris. Heart 7, which is at the flexor aspect of the wrist joint, at the proximal border of the pisiform bone, the radial to this flexor carpal ulnaris tendon. In order to bring this tendon into relief, if you get the patient to put their thumb and their little finger together, that will bring that tendon up. And just relax. Articulate the wrist and pop your point in.
Heart A is on the palmar aspect of the hand, in a dip between the heads of the 4th and 5th metacarpals, typically where the tip of the little finger rests when a loose fist is made.
Heart 9 at the radial nail point of the little finger. Going to feel for the flare, look at where the proximal and radial borders meet, look at where the nail bed is and put my point in.